Hello, fellow classmates. My name is Jennifer Shepard. Now you can put a name to my face, as I look forward to putting faces to your names. What I plan on discussing today is medical aid in dying, a topic that has been on the news recently because New York State is trying to make it a law. As a person with a terminal illness, you should be able to make a decision over your life. Aid in dying is an option. I think that medical aid in dying is a great thing. You didn't choose to be diagnosed with a terminal illness, but you should be able to choose what decision you make over your life, whether to remain suffering, possibly, or use aid in dying to die peacefully. Once you process the fact that you are going to die, you should be able to make the choice over your own life while you still can. Using the option of aid in dying is a good thing for everyone all around. It lessens the suffering for the patient, family, friends, and anyone involved. You die peacefully on your terms. I can say from personal experience that I wish New York State had this law. My son's father passed away a little over a year and a half ago at the age of 36. He was diagnosed with colon cancer, which eventually metastasized to his liver and pancreas. He fought the cancer for a little over a year. He left behind our, at the time, 13-year-old son, and he also had a 4-year-old daughter. He went from being physically fit to barely weighing anything and just looking terrible. It was heartbreaking to see a man that I once loved dying right in front of my eyes. When it came to his final days, he was at home suffering a lot. Yes, he had a dilaudid pump. We tried to make him as comfortable as possible. He ended up going to the hospital where he passed. Seeing him suffering like this still haunts me to this day. Had New York State had aid in dying, he could have used that as an option so his children didn't have to see him suffering like he did. Many of my sources came from Journal of the American Society of Aging. A poll shows that about 75% of Americans that believe that someone with a terminal illness should be allowed to end their lives if they choose to. What would you do if it was you or a family member diagnosed with a terminal illness? There are safeguards in place. It's not like you can just take the medication and die. An article written by Combs talks about the process you go through. You have to have 2 doctors sign off stating that you only have 6 months to live. You have an evaluation by a mental health provider stating that you are mentally capable of making this decision. You must be able to administer the medication to yourself, and once all of those are in place, it still is a process. You still have to wait a period of time to get the prescription, the lethal prescription. Brittany Maynard was a young woman who lived in California at the time that she was diagnosed with terminal brain cancer. She began suffering and moved to Oregon because that was the state that had offered aid in dying. At that point, California did not have that. It does at this point. She moved her entire life to a place where she could end her suffering. She became very ill, suffering a lot. She had taken the lethal dose of medication, and approximately a half an hour later, she died peacefully with her family and friends behind her. She took her life in her hands. She died on her terms. An article, response to legalized physician aid death, check yourself before you wreck yourself, talks about as a physician, you have to think about medical aid in dying prior to becoming an issue. Dr. Keith Schwartz states, and I quote, that as we move forward with deciding on how to best care for patients suffering at the end of life, I encourage us all to check ourselves before we wreck ourselves. Now, before we must choose, so at the cost of our personal and professional integrity. Dr. Sandy Buckman states, it's about providing a good death. If I can put it that way, about optimizing the dying process for a patient and their family. So in a way, it's about living. So to conclude this video, I think we should be allowed to make a choice over our lives. We were given this life to make decisions. Dr. Gawande says it perfectly, and I quote yet again, life is meaningful because it is a story, and stories, endings, matter. Thank you for listening, and feel free to ask any questions.